Welcome to Chapter 10 on Death and Dying. In this chapter, we'll be exploring different definitions of death, the types of care for dying people, funeral rituals in different religions, and the concepts of grief, bereavement, and mourning. We'll also be looking at developmental responses to death. Medical technologies like ventilators and feeding tubes can help keep people alive who would otherwise not survive. This may seem like a good thing for some, but not necessarily for everyone. Modern medicine has begun to blur the line between life and death as certain life functions can be maintained even in the absence of brain activity. The Uniform Determination of Death Act is a piece of model legislation. In other words, the text of this act was meant to serve as a guide for state lawmakers. It was then adopted by states nationwide, and it provides a more concrete definition of death for legal purposes. This act offers two definitions for when an individual may be legally declared dead. One is irreversible cessation of circulatory and respiratory functions, or irreversible cessation of all functions of the entire brain, including the brainstem. The most common type of death is the first one, in which the heart has stopped beating and/or the patient is no longer breathing, and this is usually followed by brain death. But sometimes, as is the case in the second definition, an individual may be kept alive through the use of ventilators and feeding tubes, even though there's zero brain activity. Most states consider brain dead individuals legally dead and remove them from life support, although the body's other life functions may be maintained until organs are harvested for donation. The definitions of death may seem obvious to you all, but retrospect is always 2020. It's always easy for us to look at definitions and assume that people have always thought this way. But the main purpose of this act was to align the legal definition of death with a criteria that was largely accepted by the medical community. And since modern technology has allowed for the direct monitoring of brain activity and the ability to maintain breathing and circulation in what would be otherwise fatal conditions, the traditional definition of death needed to be expanded. Now, I want to point out that although most of the states, or actually all of the states, including Washington, D.C., have adopted this act, and most of them use the exact wording of this act, some states have additional regulations. So, for example, in Florida, in order for death to be determined, this determination of death must be made by two doctors, one who is the treating doctor, and then another who's a board-eligible neurologist, neurosurgeon, internist, pediatrician, surgeon, or anesthesiologist. So this is a legislation or regulation that's above and beyond the Uniform Determination of Death Act. In Texas, Texas suggests or says that except in situations where a patient's on life support, the determination of death may be made by a registered nurse or a physician's assistant if the hospital's written policy allows. So very different way of approaching death. And these are just two examples. So there is variation that extends outside of the Universal or Uniform Determination of Death Act, but these two components are present in every state. Over years of observations, medical professionals have documented commonalities among people who are dying, and the medical practice that focuses on end-of-life care is known as hospice, and hospice professionals focus on comfort, dignity, and peace at the end of life. Patients can receive hospice care at a healthcare facility or at home. Hospice is very helpful in providing insight for the family members of patients who are dying. And one of the very helpful pieces of insight that they can provide is the death process. So when we think about the death process, it's important to note that it's really not something that is experienced exactly the same for every single person. Instead, each individual will go through the process in their own way, but knowing the commonalities of the process can help to demystify it. And an awareness can make the death process more understandable, which can help to take each person, both the individual themselves who's dying and the family member, more towards a sense of acceptance. Months before a person passes away, they'll experience mental changes, and the person may begin to withdraw. They may be reluctant to see neighbors, friends, or family members. They may mentally sort through their lives and try to seek forgiveness for past transgressions. They may also experience some physical changes like a reduced appetite or weight loss as the body starts to slow down. The person may sleep more, and they may spend time doing things, being more to themselves and engaging in less activities that they may have once enjoyed before. Weeks before passing, they'll also continue to experience mental changes, and the person's sense of perception may change. Sometimes they might experience some disorientation, restlessness, delusions, or hallucinations. So they might speak to people who aren't there. They might see people who aren't there. And also, the person will experience some physical changes that include an increased need for sleep. They may have a decrease in body temperature and a decrease in blood pressure, an irregular pulse, and changes in their skin tone and color, and some breathing changes where they may breathe more rapidly or breathing can be more labored. And in the days and hours before death, the person may have a temporary surge of energy. And so this may give hope to family members. They may think that the person's recovering, but in fact, it's very likely that the person is, if their hospice care provider and their physician has said that they are in the dying process, it's most likely that this is just a temporary surge of energy. And it can vary widely. The person may get out of bed and want to visit with loved ones. The person's appetite may return. And then this usually passes after a short period of time. And then the previous behaviors that they had will typically return, and then they become more noticeable. And there'll be a continuation of mental changes. The person may have more confusion. They may have less awareness of things that are going on around them. They may spend more time sleeping and might be more difficult to wake up. They may withdraw more than before, and they they may also seem restless, where they're picking at covers or reaching in the air for things. But this is not something to worry about. This is a normal process, and some of these changes have to do with reduced oxygen and blood flow to the brain. As the person continues through the death process, they'll experience some additional physical changes, such as the inability to swallow, and breathing will change where it becomes slower and more irregular. The person's breathing may be exhibited by what's called Cheyne-Stokes breathing. And this is where the person will breathe deeply and rapidly, and then they'll breathe slow, shallow breaths, or they may stop breathing altogether for a moment. I think this is one example among many of why it's helpful to have a hospice nurse who can provide insight for the family about what the family can do to help to make their loved one more comfortable. So that, for example, in this instance, they might want to let the family know that when they see that their family members experiencing this, elevating that person's head or helping them to turn on their side to be more comfortable and relaxed would be very helpful. So, hospice nurses play such an important role in this overall process. Aside from caring for the patient, they're also there to help to provide information and to provide guidance and insight and support for the family. As the person is continuing in this process, they may also have some congestion in their airways, which can cause a rattling sound. And if the person has had congestion before, it may be really loud, which can be very upsetting for the loved ones. The person's hands and their feet may become more blotchy because they're not getting the amount of blood flow that they had before. that to their extremities, and instead the blood's going to their vital organs to help those to function. As the person continues to move towards the very end of life, their muscles are going to become relaxed, and they may develop incontinence. And the person also, as they are at the very end of life, and as they pass, you'll notice that their breathing and their heartbeat stops, and their bowel and bladder may release, and their eyelids may be slightly open. And if the person is at home at the end of their life, hospice care can be a very valuable resource for the patient and their family. And the hospice caregiver can explain the next steps after the end of life. If the person dies at home and a hospice care person is not assisting, then the family, of course, would need to call the doctor and or 911. And then also the funeral home. So we're going to be taking a look at different approaches to thinking about death. We're also going to be taking a look at the stages of death and dying according to Kubler-Ross. We'll also be looking at some cultural variables that are important for us to think about when we think about death and dying. We'll be looking at a lot of very interesting issues that are related to this very difficult but also very important area of study. Although the Uniform Determination of Death Act that we see in each state clearly defines what death is, what is often experienced by many people before they die is what we could call social death. Social death can be characterized by dehumanizing and withdrawing from someone who's terminally ill. It may involve ignoring them, talking about them as if they were not present, making decisions without consulting them first, visiting less often, talking about superficial topics, and this may occur with friends or family or healthcare providers. Why does this happen? Well, it can be due to some feelings of inadequacy that those who are loved ones feel about their ability to handle the overall outcome that they're facing. Also, it can be caused by wanting to distance oneself from the reality of death. And also, it can be due to a need for emotional distance to protect against grief and burnout. Most of you are probably familiar with the most common causes of death in the United States. And as of 2018, the leading causes of death in order of number of deaths were heart disease first, then cancer, then unintentional injuries, then chronic lower respiratory diseases, then stroke, Alzheimer's disease, diabetes, influenza, and pneumonia, and kidney disease, and then suicide. I do think it's important to point out that the cause of death or the leading cause of death can vary by state. For example, in West Virginia, the leading cause of death is heart disease, whereas that's not the leading cause of death in Washington, D.C. And West Virginia, for example, has the highest death rate for accidents, whereas in Tennessee, we have much lower rates of death that are due to that. So it does vary by state. The causes of death also vary by age. So if you'll look at your textbook, you'll note that the most common cause of death for people who are under 1 year of age are congenital abnormalities. And then between the ages of 1 and 44, the most common cause is unintentional injury. And then from 45 to 64, malignant neoplasms. And that is a cancerous tumor or an abnormal growth that can grow uncontrolled and spread to other parts of the body. And then heart disease is the most common for people who are age 65 and over. And figure 10.2 in your textbook illustrates the leading causes of death in the United States, and this was in 2015. And you'll note that heart disease was the leading cause of death, and then cancer was second, and then third, which was very distant from cancer, much lower in its percentage, was chronic lower respiratory diseases, and then many others are listed, and they're pretty much in the same order that I gave you just now. Not much has changed since since 2015. More than 50 million people die each year, and this number continues to increase as our global population increases. The majority of deaths are due to cardiovascular disease, cancer, diabetes, and chronic lung diseases. In many countries where people have taken on a Western diet, we're seeing that lifestyle factors, including obesity and lack of physical activity and overall poor eating habits, are contributing to diseases that would not have existed prior to taking on the Western diet in their country. In low-income countries, more than half of deaths are due to things like communicable diseases, maternal causes, conditions that are arising, for example, during pregnancy and childbirth, and nutritional deficiencies. 9% of deaths around the world are due to auto accidents, and in low-income countries, they have the highest annual road traffic fatality rates, while high-income countries have the lowest. In high-income countries, 70% of deaths are among people who are over the age of 70, and chronic diseases are the primary cause of death. But in low-income countries, almost 40% of deaths are among children who are under the age of 15. And childbirth complications are a common cause of death for infants. Why do you think so many deaths occur among children who are under the age of 15 in low-income countries? Some factors contributing to this can be infant mortality. Additional ones can be communicable diseases. These are diseases that are transmissible or infectious diseases, and these can result from infection or the growth of pathogens. For children who are under the age of 5, in 2018, pneumonia, diarrhea, and malaria were responsible for approximately 29% of their deaths globally. In particular, it's children who are living in the world's poorest regions who are disproportionately affected, with infectious diseases particularly prevalent in sub-Saharan Africa. So, what have you learned about? You've learned about physical death and how death is defined. You've also learned about the stages and characteristics of the death process, and you learned about something called social death. You also learned about some of the most common causes of death around the world. So what's next? Next, you're going to learn about where people die. Do they die more often in hospitals or at home? And this relates to one of the Reading the Research articles that you read. You'll also be learning about how people at different stages of development understand death. We'll be looking at the understanding of death in infancy, toddlerhood, early childhood, middle childhood, adolescence, early and middle adulthood, and late adulthood. In other words, each of the stages of development that you've learned about in this course. You'll also be learning about curative, palliative, and hospice care, and the important role of family caregivers and the effects of caregiving on the caregiver themselves.